My name is CJ Chum. I am class of 2027 and I'm majoring in neuroscience.
My name is Georgiana Morris. I'm a first year political science major.
Hi, my name is Caresli Corona. I am a first year biology major.
I've been in this club since fall quarter and right now it's spring quarter. So that's just since the beginning of this year. I'm a freshman.
I joined my freshman fall quarter and have been in this club from then till now, so 2 quarters.
I have been in this club for 2 quarters.
FISH is a UCLA student-run organization which tries to promote sustainability in the service that we provide to a little community in Mexico, Maclovia Rojas, which is just outside of Tijuana, and we do so by way of healthcare screening, so blood, glucose and blood pressure, and we also give free English lessons to students in the community. And we do that on a really regular basis as well, so that we're having iteration and they feel more secure and able to ask us what we can, or we can ask them and they can tell us what we can be doing to better support them in providing them with sustainable service and support.
Well, I was interested in working with healthcare and doing medicine in the future, and I wanted to look into more options, and I thought global health was a great thing to do. So I looked into the global health clubs at UCLA, and I saw that FISH had a really nice mission of sustainability and working with global health, specifically in Tijuana and serving communities there. So I decided to join FISH.
I chose to join FISH because I wanted to be part of a community that serves others and has a strong connection to them.
It really depends on how much you want to really put into this club. For me, I'm in the research and development committee, and if I would like to, I could spend 1 to 2 hours a week on this club. But I'm also want to start going on with some projects I have for the research committee. And FISH is very flexible and open to these ideas. So after I talk to my directors or my officers, they're able to give me approval. And for example, a couple weeks ago, I was changing the intake forms, and that was taking 5 to 10 hours a week. But it's really what you want, and honestly, whether you do 3 hours a week or 5 hours a week, no one would judge, since as long as you're still taking part in the clinics, and the clinics are 12-ish hours, but that's once a quarter, and it's also really fun.
As a general member, we are required to do bi-weekly meetings with the whole club, as well as a social to get to know people in the club, and we have to go on trip at least once per quarter. Also, before the meetings, we do Spanish modules to practice on our Spanish, because being part of FISH, you have to be culturally competent, and the language is a very important part of this.
Yeah, I really like taking the role of doing blood pressure screenings during our clinics. I felt like it really showed me how much of first off of a language barrier there is, because I myself didn't speak Spanish, which is something not a lot of members did speak Spanish. So it really showed me how important it is to be able to speak their language, so that you can really relate to them. But at the same time, even though there was a language barrier, there was still a mutual respect for each other, since I was giving them blood pressure, and they were just being kind to me.
I would say my first trip, it was during week 1, so it was the first one ever, and wasn't initially gonna go, but then they needed an extra driver, so I went. So I didn't really have a position, so they put me on flyering. And I actually really enjoyed the flyering and just being a part of the outreach process, like seeing just how many people are taking the flyers, how many people are actually like taking the flyers and then like coming to get blood pressure screened. And it's just really cool to be a part of like seeing and like providing people with basic needs like that.
My most memorable experience was seeing the joy in the kids who were in the English lessons and the way I brought that joy to them.
I would say the like growth, like action mindset that I think this club has, and they really implement it every meeting that we have every other week after each trip. Each meeting is like immediately after the trip of that week, and so they always like right off the bat talk about notes that all the members in their different like positions have like taken and what they think that we can improve on. And I really appreciate that the club like leaders take in like what we're experiencing as like the associates going on trip, and then also throughout the whole trip they're also talking with like the leaders that are permanently in Maclovia Rojas too. And I think that that's really helpful in like our action towards like Maclovia and being able to be constantly growing and adapting to like what their needs are.
I think that what sets this club apart from others is that we have created a strong connection with a community, and we build a relationship with them, and not only that, but we take in their input and their suggestions and their needs and like evolve the club toward what they need.
I realized that healthcare is like much more open to like everyone than I originally thought it was. I kind of thought that healthcare was like only like pre-med students or people actually going into like a health like field. So I'm political science, so when I first saw this club I was like, oh, I like really want to join this, but is it for me? Like it seems like maybe it would be just a pre-med club. But then I was looking into it and I saw that all the past like directors, some of them were not like pre-med majors, and I was like, oh, okay, like let me give this a shot. And then I joined, and then being in the club I really did realize that like all the teams too like work together in like totally different fields, and they all like come together just to like support the people in Maclovia. And I think that that is something that changed my mindset on healthcare, that even though like I'm not going to like work in healthcare, that I can still like be a part of like providing healthcare to people in need. And I think that's a really cool thing that Fish does.
This club has changed my view on healthcare and making me realize that there are different areas that help with providing healthcare for others. For example, I'm in research and development, and before that I didn't know that there was a lot of research that had to be done about the community or the people you're providing healthcare to. And I used to think it was just, oh, we're like, healthcare is just like, oh, the doctor or the nurse or this, but there's a lot that goes into it before we get to that point.
I'd say anyone that's genuine to healthcare in general, and if anyone's looking for more perspective on healthcare, then this is definitely a really good club, because the patients you encounter are much different from the ones like you usually would at like a hospital setting like in the US or like your local clinic.
I think this club is unique in being kind of open to people in all like walks of life and like where they are and like their career aspirations and whatnot. But I think what ties us all together is our like need to, or not need, but like want to like be selfless and culturally competent and like providing support and service where like it's most needed. And I think that that kind of impact is really strong. And I think our connection is greater because, and our like work is more like impactful because of our connection on such like a deep basis of service.
Is someone who is open-minded, puts others before themselves, and wants to be part of an impact, specifically in this community that we serve, Maclovia Rojas, and is ready to create strong relationships with those people.